Continuing education activity. Amlodipine is an oral dihydroprotease calcium channel blocker. Amlodipine works by blocking the voltage-independent L-type calcium channels, thereby inhibiting the initial influx of calcium. Compared to nifedipine and other medications in the dihydroprotease class, amlodipine has the longest half-life at 30 to 50 hours. The benefit of such a long half-life is the ability to have once-daily dosing. Amlodipine is available as amlodipine Besled, which was initially approved in 1987 by the FDA. This activity reviews the indications, contraindications, activity, adverse event objectives, identify the uses and indications of amlodipine, both approved and off-label, describe the mechanism of action of amlodipine, summarize the adverse drug reactions of amlodipine, outline interprofessional team strategies for improving care coordination and communication to advance the knowledge on amlodipine and improve outcomes. Indications. Amlodipine is an oral dihydroprotease calcium channel blocker. Amlodipine is available as amlodipine Besled, initially approved in 1987 by the Food and Drug Administration FDA. FDA-approved indications. Hypertension. Amlodipine is an excellent first-line choice among the multiple options of antihypertensive agents. It may be used alone or in combination with other antihypertensive agents. 1-2. Chronic stable angina. Amlodipine is indicated for the symptomatic treatment of chronic stable angina. Amlodipine may be used alone or in combination with other antianginal agents. 3. Vasospastic angina or Prinzmetal or variant angina. Amlodipine is indicated to treat confirmed or suspected vasospastic angina. 4. Angiophysially documented coronary artery disease GATO in patients with recently documented CAD by angiophry and without heart failure or an ejection fraction. 40. Amlodipine is indicated to reduce the risk of hospitalization from angina and reduce the risk of a coronary revascularization procedure. 5. Non-FDA approved indications. Diabetic nephropathy. 6. Left ventricular hypertrophy. 7. Raynaud phenomenon. 8. Silent myocardial ischemia. 9-10. Group 1 pulmonary arterial hypertension. Hepatic use only in idiopathic patients with positive vasodilator testing. 11. Normally, vascular smooth muscle contraction initiates when calcium enters the cell via voltage-independent L-type calcium channels. The calcium binds to intracellular calmodins, which binds to and activates myosin light chain kinase or MLECO. MLEC is responsible for the phosphorylation of the myosin light chain, ultimately leading to muscle contraction and vasoconstriction. The vascular smooth muscle contraction becomes further amplified by calcium-induced calcium release from the sarcoplasticum reticulum. This sequence of events leads to a decreased vascular cross-sectional area, increased vascular resistance. Amlodipine works by blocking the voltage-dependent L-type calcium channels, thereby inhibiting the initial influx of calcium. Reduced intracellular calcium leads to decreased vascular smooth muscle contractility, increased smooth muscle relaxation, and a resultant vasodilatation. Additionally, amlodipine has improved vascular endothelial function in hypertensive patients. Amlodipine decreases blood pressure by inducing smooth muscle relaxation and vasodilation. 3. Amlodipine's role in relieving stable angina is due to the lowering of afterload secondary to its vasodilating and antihypertensive properties. Reducing afterload leads to lowering myocardial oxygen demand at any level of exertion, as the heart does not need to work as hard to pump blood into the systemic circulation. Amlodipine also alleviates Prinzmetal or variant angina by blocking coronary spasms and restoring blood flow in the coronary arteries. 12. Raynaud phenomenon. RPO is an excessive vascular response to cold temperature, manifested clinically by color changes of the distal skin of the digits and toes, nose, and earlobes. Amlodipine induces smooth muscle relaxation and is an effective short-term treatment for patients with Raynaud's phenomenon. 13. ACE inhibitors. ACE and angiotensin receptor blockers ARBs are the initial treatment of choice for diabetic nephropathy. However, clinical trials have shown that combined antihypertensive therapy with either amlodipine plus and ARBs ACE plus exerts a greater antihypertensive effect in patients with type 2 diabetic nephropathy. 14-15. Ascot Anglo-Scandinavian outcome trial that demonstrated that an amlodipine-based blood pressure regimen decreased the long-term incidence of stroke compared with atinola, but further research is still required. 16. Absorption of the absolute bioavalanche of amlodipine is between 64 and 90. Food doesn't alter the bioavalanche of amlodipine. Peak plasma concentrations are achieved between 6 and 12 hours. Steady-state plasma levels are achieved after 7 to 8 days of daily dosing of amlodipine. Patients with hepatic dysfunction have decreased clearance of amlodipine accordingly. There is an increase in of approximately 40 to 60. Distribution of amlodipine has high plasma protein binding in 93. Metabolism of amlodipine is extensively metabolized by the liver to inactive metabolite. Excretion of the plasma half-life of amlodipine is biphasic with a terminal elimination half-life of about 30 to 50 hours, which is increased with hepatic dysfunction. The primary route of excretion is renal at 10 of the parent compound and 60 of the metabolites are excreted in the urine. Go to administration. Amlodipine is primarily administered orally and is available into 0.5 mg, 5 mg, and 10 mg tablets. In addition, suspensions created from oral tablets are available for pediatric and elderly patients with difficulty swallowing. Compared to nifedipine and other medications in the dihydropartines class, amlodipine has the longest half-life at 30 to 50 hours. The benefit of such a long half-life is the ability to have once daily dosing 17. Recommended dosages. Hypertension. Adults initial dose 5 mg once daily and maximum dose of 10 mg per day. Geriatric and debilitated patients are reduced initial dose to 2.5 mg once daily and maximum dose of 10 mg per day. Adolescents and children 6 years of age or older to 0.5 to 5 mg once daily and maximum dose of 5 mg per day. Children 6 years of age or younger 0.5 to 0.2 mg per day, a maximum dose 0.3 to 0.6 mg per day up to 5 mg per day. CAD chronic stable angina, Prinzmental angina, CAD documented by free and without heart failure or ejection fraction less than 40. Adult cell initial dose 5 to 10 mg once daily. Elderly and debilitated patient cell initial dose 5 mg once daily. Usual dose is 10 mg once daily for amlodipine can be used as monotherapy or in combination with several different medications to manage hypertension or CAD in patients. Common combinations include amlodipine atorvastatin. Atorvastatin is a lipid-lowering agent that blocks cholesterol synthesis and is administered to reduce cardiovascular events. 1920. Amlodipine aliskiren or amlodipine aliskiren hydrocolurgic is a direct renin inhibitor that binds renin and prevents activating the renin-angiotensin-aldosterone system RASA. Hydrocolurgic is a thiazide diuretic that leads to a reduction in blood volume. Both combinations lower blood pressure. 2120. Amlodipine benaceplar or amlodipine parenteropa. Benaceplar and parenteropa are ACE inhibitors that block the conversion of angiotensin I to angiotensin E in the RAS. 23. Amlodipine olmostramate or amlodipine telmisartanate or amlodipine valsartan. Olmostramate, telmisartan, and valsartan are angiotensin E receptor blockers that inhibit the activity of angiotensin E in the RAS. Use in specific patient population. Patients with hepatic impairment to amlodipine is primarily metabolized by the liver, and the plasma elimination half-life is prolonged with impaired hepatic function. A gradual titration of the dose is recommended. The initial dose is to 0.5 mg once daily for hypertension or 5 mg once daily for angina. Adjust the dosage based on clinical response. Patients with renal impairment of the pharmacokinetics of amlodipine is not significantly influenced by renal impairment. Pregnancy considerations. Untreated hypertension in pregnancy increases the risk for preeclampsia, premature delivery, intrauterine growth restriction, and intrauterine death. Chronic hypertension in pregnancy. CHAPA results indicate that in pregnant women with mild chronic hypertension, an approach of target blood pressure of less than 140/90 mg was associated with better pregnancy outcomes than a strategy of reserving treatment only for severe hypertension. 26. Based on these findings, The American College of Obstetricians and Gynecologists (SUCOGA) and the Society for Maternal and Fetal Medicine (USMAMA) guide breastfeeding considerations. Human milk levels of amlodipine are low, and plasma levels in breastfed infants are undetectable. Maternal use of amlodipine during breastfeeding has not caused any adverse effects in breastfed infants. Consequently, amlodipine is acceptable in nursing mothers. Go to adverse effects. The significant adverse effects of amlodipine include peripheral edema, heart failure, pulmonary edema, flushing, dizziness, headache, drowsiness, skin rash, nausea, abdominal pain, and constipation. Researchers observed edema, dizziness, flushing, and palpitations in controlled clinical trials in a dose-dependent manner. For example, at a dose of 10 mg, the incidence of edema, dizziness, flushing, and palpitations was 10.8, 3.4 to 0.6, and 4.5, respectively. In addition, the incidence of calcium channel blockers, including amlodipine, have been linked to rare instances of idiosyncratic drug-induced liver disease. A mixed hepatocellular pattern is a typical feature of amlodipine-induced liver injury. 33 Complete recovery is anticipated after stopping the drug within 4 to 8 weeks. 30 For codeine of amlodipine and clarithromycin senicus or erythromycin has reportedly increased the risk of hypotension and acute kidney injury due to decreased metabolism by ciftrifure. 35 Additionally, when amlodipine is used with high doses of statins, there is an increased risk for myopathy and rhabdomyolysis. 36 It is important to note that amlodipine can cause peripheral edema. A prescribing cascade occurs when the edema is mistaken as a new medical condition, and a diuretic is consequently prescribed to treat the edema. Contraindications. Amlodipine is contraindicated in patients with known hypersensitivity to amlodipine or its dosage form components. In addition, amlodipine is relatively contraindicated in patients with cardiogenic shock, severe aortic stenosis, and stable angina, severe hypotension, heart failure, and hepatic impairment. According to the manufacturer's labeling, patients with severe coronary artery disease may have worsening angina after initiating amlodipine therapy. In cardiogenic shock, the heart cannot pump effectively, which is exacerbated by inhibiting the influx of calcium ions into cardiac cells. In severe aortic stenosis, amlodipine can cause ventricular collapse and dysfunction. Amlodipine causes a reflexive increase in cardiac contractility and unstable angina, increasing myocardial oxygen demand and worsening ischemia. Amlodipine can further reduce blood pressure, hyperperfusion it to vital organs, and syncope in patients with severe hypotension. 38 Heart failure patients may experience pulmonary edema, shortness of breath, and dyspnea with amlodipine. Patients with hepatic impairment may not metabolize amlodipine effectively, leading to a longer half-life with possible increases in plasma concentrations. 40 Go to monitoring. In general, laboratory monitoring is not necessary for patients taking amlodipine. Since amlodipine is an antihypertensive medication, clinicians and patients should regularly measure blood pressure to achieve target levels per the 2017 American College of Cardiology American Heart Association licensure hypertension guidelines. Furthermore, the healthcare team should monitor patients for adverse side effects such as peripheral edema, dizziness, and flushing. 41 Amlodipine may increase the of tacrolimus. In one study, amlodipine decreased the tacrolimus clearance by 0.2 to 3.8 folds, increasing on systemic exposure in CYP expressors. Consequently, monitoring of trough blood levels of tacrolimus is suggested. 40 Go to toxicity. Amlodipine overdose and toxicity can lead to massive vasodilina, hypotension, and reflex tachycardia as compensatory mechanisms. Prolonged systemic hypotension can progress to shock and even death. Activated charcoal laces should be administered to patients with amlodipine overdose. The hypotension usually remits intravenous with a fluid resuscitation if calcium gluconate and misoprostol therapy with norepinephrine or dopamine. High-dose insulin is also sometimes administered as research has shown it to lower mortality and improve hemodynamics. electrocardiographic results, vital signs, kidney enhancing healthcare team outcomes. Amlodipine is an excellent first-line choice among the myriad options of antihypertensive agents. Amlodipine has also shown robust reductions in cardiovascular and hence especially stroke. In addition, compared to nifedipine and other medications in the dihydropartines class, amlodipine has the longest half-life at 30 to 50 hours. The benefit of such a long half-life is the ability to have once-daily dosing. Therefore, healthcare providers, including clinicians, pharmacists, nurse practitioners, etc., should be familiar with the indications and contraindications of amlodipine. Amlodipine therapy requires the participation of the entire interprofessional healthcare team. Clinicians, meds, DOS, PINs, BAZO, and specialists will typically initiate treatment. The pharmacist should report to the clinician for potential drug interactions, e.g., simvastatin or erythromycin. In addition, pharmacists should verify dosing and educate the patient about the common adverse drug reactions. The nurse should assess patient adherence and offer to counsel on medication administration. Both nursing and pharmacy staff should alert the prescriber if they encounter any issues. In an acute the interprofessional team approach can improve patient outcomes related to amlodipine therapy by maximizing efficacy and minimizing the risk of adverse drug reactions. In addition, a pragmatic randomized controlled trial indicated that team-based carabitiesa involving community pharmacists and nurses working in an interprofessional manner with clinicians could accomplish long-term blood pressure control related to antihypertensive therapy, including calcium channel blockers. Why is this medication prescribed? Amlodipine is used alone or in combination with other medications to treat high blood pressure in adults and children 6 years and older. It is also used to treat certain types of angina, chest pain, and coronary artery disease, and narrowing of the blood vessels that supply blood to the heart. Amlodipine is in a class of medications called calcium channel blockers. It lowers blood pressure by relaxing the blood vessels so the heart does not have to pump as hard. It controls chest pain by increasing the supply of blood to the heart. If taken regularly, amlodipine controls chest pain, but it does not stop chest pain once it starts. Your high blood pressure is a common condition and when not treated can cause damage to the brain, heart, blood vessels, kidneys, and other parts of the body. Damage to these organs may cause heart disease, a heart attack, heart failure, stroke, kidney failure, loss of vision, and other problems. In addition to taking medication, making lifestyle changes will also help to control your blood pressure. These changes include eating a diet that is low in fat and salt, maintaining a healthy weight, exercising at least 30 minutes most days, not smoking, and using alcohol in moderation. How should this medicine be used? Amlodipine comes as a tablet and in suspension liquid to take by mouth. It is usually taken once a day. To help you remember to take amlodipine, take it around the same time every day. Follow the directions on your prescription label carefully and ask your doctor or pharmacist to explain a part you do not understand. Take amlodipine exactly as directed. Do not take more or less of it or take it more often than prescribed by your doctor. Shake the suspension well before each use to mix the medication evenly. Your doctor will probably start you on a low dose of amlodipine and gradually increase your dose. Amlodipine helps to control high blood pressure, angina, and coronary artery disease, but does not cure these conditions. Continue to take amlodipine even if you feel well. Do not stop taking amlodipine without talking to your doctor. Other uses for this medicine. This medication may be prescribed for other uses. Ask your doctor or pharmacist for more information. What special precautions should I follow before taking amlodipine? Tell your doctor and pharmacist if you are allergic to amlodipine, any other medications, or any ingredients in amlodipine tablets or suspension. Ask your pharmacist for a list of the ingredients. Tell your doctor and pharmacist what prescription and non-prescription medications, vitamins, nutritional supplements, and herbal products you are taking or plan to take. Be sure to mention any of the following as certain medications for seizures such as carbamazepine, carbitrol, etrio, tegretol, phenytoin, pheneteca, and phenobarbital, clarithin, seneca, sabiaskin, and prevacol, cyclosporine, again graph, neural, sandimuna, vasorins, assistivo, and the navinocrixivino, atraconazole, honol, sporinoxora, ketoconazole, and viscerol, lovastatin, alteprev, and Advocora, Nefisdono, and Nelfenaverno. Tell your doctor if you have or have ever had heart failure, heart or liver disease. Tell your doctor if you are pregnant, plan to become pregnant, or are breastfeeding. If you become pregnant while taking amlodipine, call your doctor. What special dietary instructions should I follow? If your doctor prescribes a low-salt or low-sodium diet, follow these directions carefully. What should I do if I forget a dose? Take the missed dose as soon as you remember it. However, if it is almost time for the next dose, skip the missed dose and continue your regular dosing schedule. Do not take a double dose to make up for a missed one. What side effects can this medication cause? Amlodipine may cause side effects. Tell your doctor if any of these symptoms are severe or do not go away. Swelling of the hands, feet, ankles, or lower legs, headache, upset stomach, nausea, stomach pain, dizziness or lightheadedness, drowsiness, excessive tiredness, blushing. Some side effects can be serious. If you experience any of these symptoms, call your doctor immediately or get emergency medical treatment. More frequent or more severe chest pain, rapid pounding or irregular heartbeat, fainting. If you experience a serious side effect, you or your doctor may send a report to the Food and Drug Administration's FDA MedWatch Adverse Event Reporting Program online or http:// FDA.gov Safety MedWatch or by phone 1-800-330-210 later. What should I know about storage and disposal of this medication? Keep this medication in the container it came in, tightly closed and out of reach of children. Store the tablets at room temperature and away from excess heat and moisture, not in the bathroom. Store the suspension in the refrigerator and avoid freezing and protect it from light. It is important to keep all medication out of sight and reach of children, as many containers such as weekly pill minders and those for eye drops, creams, patches, and inhalers are not child-resistant, and young children can open them easily. To protect young children from poisoning, unneeded medications should be disposed of in special ways to ensure that pets, children, and other people cannot consume them. However, you should not flush this medication down the toilet. Instead, the best way to dispose of your medication is through a medicine take-back program. Talk to your pharmacist or contact your local garbage recycling department to learn about take-back programs in your community. See the DOF Safe Disposal of Medicines website, http:// for more information if you do not have access to a take-back program. In case of emergency overdose. In case of overdose, call the Poison Control Helpline at 1-800-222-1222. Information is also available online at tapswf.poisonfall.org. If the victim has collapsed, had a seizure, has trouble breathing, or can't be awakened, immediately call emergency services at 911. Symptoms of overdose may include dizziness, fainting, rapid heartbeat. What other information should I know? Keep all appointments with your doctor. Your blood pressure should be checked regularly to determine your response to amlodipine. Do not let anyone else take your medication. Ask your pharmacist any questions you have about refilling your prescription. It is important for you to keep a written list of all of the prescription and non-prescription over-the-counter medicines you are taking, as well as any products such as vitamins, minerals, or other dietary supplements. You should bring this list with you each time you visit a doctor or if you are admitted to a hospital. It is also important information to carry with you in case of emergencies. Expand all. What is kratom? How does kratom affect the body? Researchers are still learning how kratom and kratom compounds affect the body, as well as how short or long-term kratom use may impact health. While evidence is quickly evolving, early studies have revealed important information about how the drug works. Effects may vary widely. Like all drugs, kratom's effects may depend on the amount taken, potency of concentration, and strength of formulation of the product, the way it is ingested, other drugs in a person's system, a person's underlying medical conditions, and a person's previous experience with the substance, among other factors. 3, 4, 17. Importantly, kratom products vary, so effects are difficult to predict. Some kratom products have been found to contain contaminants that produce effects not associated with kratom or kratom compounds alone. 6, 7, 21. Learn kratom produces opioid and stimulant-like effects. People who use kratom report both stimulant-like effects, increased energy, alertness, and rapid heart rate, and effects that are similar to opioids and sedatives or relaxation, pain relief, and confusion. While many people who use kratom report that smaller doses of kratom produce stimulant-like effects and larger doses produce opioid or sedative-like effects, for studies have not yet established that these effects depend on the amount or method of kratom consumed. 10, 17. Mudragenin, 7-hydroxyzyranyl, and other kratom compounds drive these effects. The effect of kratom products can vary depending on the concentration and combination of specific kratom compounds within the product. While kratom leaves contain many chemical compounds that may influence the human body, the most well-studied is mudragenin. When ingested, mudragenin breaks down into another chemical called 7-hydroxyzyranyl, which also influences the body and is an important subject of research. 20. To learn more, how do kratom compounds work in the brain? Adverse effects range from mild to severe. Some people who use kratom have reported mild side effects, such as nausea, dizziness, and drowsiness. 3, 4. In case reports, clinicians report seeing patients with a wide range of rare but serious adverse effects associated with kratom exposure, including mental and neurological symptoms, confusion, tremors, and seizures, heart and lung problems, high blood pressure and slow breathing, gastrointestinal problems, nausea and vomiting, and liver problems. 1, 23. A very small number of deaths have been linked to kratom products, and drug interactions may influence effects. Studies suggest many people who use kratom also use other drugs and have conditions for which medications are often prescribed. 3, 4, 17. Case reports suggest using kratom in combination with other drugs, sometimes called polysubstance use, may produce severe adverse effects, such as liver problems or even death. 25. More research is needed to better understand the impact of using kratom in combination with other substances. Is kratom safe? Long-term health effects are not well understood. Because kratom research is relatively new compared to more widely used drugs, there is little evidence to determine how kratom use may affect someone over time. Case reports do show regular, long-term kratom use in large amounts may be associated with serious liver problems. These cases appear to occur unpredictably in a small minority of people who use kratom, and it isn't clear what role other substances and underlying health conditions may play. 9, 26. Is kratom safer? Researchers are also still learning how often and to what extent people who use kratom experience with research on potential therapeutic effects of kratom is ongoing. Researchers have not proven kratom to be safe or effective for any medical purpose, though kratom has been used in traditional medicine. Many people who use kratom products report doing so to self-treat pain, anxiety, depression, fatigue, and drug cravings and withdrawal symptoms, especially related to opioid use. 1, 3. NIDA supports and conducts research on therapeutic uses of kratom and related compounds. Learn more. Could kratom be used as medicine? Kratom en español. Highlights. Image. Close-up of researchers inspecting cultivated kratom leaves. Asir University of Florida College of Pharmacy. Kratom commonly refers to an herbal substance that can produce opioid and stimulant-like effects. Kratom and kratom-based products are currently legal and accessible in many areas. The U.S. and international agencies continue to review emerging evidence to inform kratom policy. 1. While there are no uses for kratom approved by the U.S. Food and Drug Administration, people report using kratom to manage drug withdrawal symptoms and cravings, especially related to opioid use, of pain, fatigue, and mental health problems. 130. For NIDA supports and conducts research to evaluate potential medicinal uses for kratom and related chemical compounds. NIDA also supports research towards better understanding the health and safety effects of kratom use. Rare but serious effects have been reported in people who use kratom, including psychiatric, cardiovascular, gastrointestinal, and respiratory problems. 15. Compared to deaths from other drugs, A very small number of deaths have been linked to kratom products, and nearly all cases involved other drugs or contaminants. 1,678,910.